Today we're going to be talking about what this box has to do with your back pain or possibly your pelvic floor issues. We're going to get to that today, but if you have any ideas, then let me know in the comments. My name is Juanita Benedict. Look at this fancy stuff I've got going on. Welcome to, here we go. There we go. Look at that. Welcome to the Athena Pelvic Therapy Facebook page, where every single week I'm going to be doing a Facebook Live in order to bring hope and help to those people who are suffering with pelvic floor issues. Today, we are going to be talking about something that I hear quite frequently in the pelvic floor world, and that is this issue of back pain. Should you have back pain? Is it separate from the pelvic floor? Is it the same? We're going to talk about that today. But first, I want to let you know that, like I said before, every single Wednesday, I'm going to be going live. I get my ideas for my live broadcasts based upon questions that I've heard from my clients over and over again. Also, just questions that people ask me in general. I want to thank you for watching, whether you're here during the live session or perhaps you're going to join me a little bit later on a replay or even on YouTube, because when this is all over, I'm going to edit a bunch of stuff and get it nice and concise and put it over on YouTube. But again, the question that we're going to be answering today is whether or not your back pain could be related to some pelvic floor issues. Now, we don't often think of that, but it is something that we should think of. So what I want to do is I have props. I have props today, people. I love my props. So how I want to start is I want to take this shoestring. It's just a regular shoestring. And I want to ask you guys a question. If I take this shoestring and I stretch one part of it, right? If I stretch it, can I only stretch one part without affecting the rest of the string? Or is the entire string stretched or affected in some way? So you can certainly answer in the comments if you would like, but I'm sure that we can all agree that it's really going to be hard unless I isolate just one particular area of the string to push and to pull and to move around. It's going to be hard for me to isolate just one area without affecting the rest. And even if I do that, just by holding on to this part, even when I'm stretching and moving this is still being affected in some way because it is moving, right? So it's not perfectly still. It's not the same that's going to happen if it's not being stretched or moved around by myself. And that is what I want to talk to you today about, because we are all connected inside of our bodies. Everything is connected. Even when I was practicing in a more orthopedic setting, when people would come in and talk to me about having back pain, one of the first things I would do is say, do you also have neck pain? Do you have headaches? Do you have pain that's shooting down your legs? Because all of these things are connected, and it's in such an amazing way. Our bodies are really amazing and fantastic. So today we're going to look at what happens when we're connected. Okay, so I was so excited today. I want to make sure my address doesn't appear anywhere on here. Okay, here it is. So I was so excited today because I had ordered something from Amazon. And how many of you, go ahead and type in the comments or give me a thumbs up for a like, how many of you have done a little too much shopping on Amazon over the past month or so? If you are like my husband and myself, I'm telling you, we have gotten so many Amazon packages, it's ridiculous. So I have all of these extra boxes lying around. And today I got something that I was super excited about and I was waiting to get. And I got my box. I got another box. So what can we do when our box is open? We can put things in the box, right? And that's exactly what boxes are for. And the great thing about putting things in the box is that it stays in the box. Now, why does it stay in the box? Because the box has a bottom, right? And the bottom is pretty sturdy. And because this box is so sturdy, we can put lots of different things inside of the box. For example, in this box came my iPad that I have been waiting for forever. So I was super excited about that. Never had one before. That's a tangent we don't need to go on. However, that's what I was excited about. So my iPad, which was very valuable, sat right in this particular box. Now, I'm going to ask you a question. What if my kids had done the dishes and they had wiped off the counters? Oh, I'm living in a dream world right there. But let's just pretend and say that they wiped off the counters, but they didn't dry off the counters. And if you knew my kids, you would know that there's probably a ton of water left on the counter from them wiping it off, okay? So what if I didn't realize that that was the case? And what if I took the box, my beautiful box with my beautiful iPad in it, or whatever I wanted to put in here, and I put it on top of that wet water, and I just left it there because I didn't realize it? What would start to happen to the bottom of the box? It would start to get soggy, right? And then as the cardboard gets soggy, is it going to be as durable as before it was soggy? Well, the answer is no, right? It's not going to be as durable. Well, why not? Well, because it's been compromised. The fibers that make up the cardboard are now not as strong as they once were because they've been compromised by the water seeping in. So let's say I have something very heavy, a weight, or just something very heavy inside of this box, and I go to pick it up. What's going to happen if I have a soggy bottom of the box? Yeah, you guessed it, right? If it's really soggy or the box is really kind of icky, then things are just going to fall out, right? It's just going to fall out of the box. Now, if you're a woman watching this, you may have heard of something called a prolapse. And what happens to us is that things start actually falling out. I'll get back to that though. So if we imagine that this box is like our bodies, then we can start to understand the relationship between our lower back and our pelvic floor, right? So let's imagine that this is our body. And no, we don't have to be SpongeBob SquarePants, right? We don't have to be that way, although it might be fun, especially after this mess. But if the bottom is your pelvic floor, right? That's what we're saying is your pelvic floor to hold everything in. Then this is going to be your front, and your front is going to be your abdominals. Now, let's be honest. How many of us wish that we had a front this flat, right? But we don't. Most of us don't. We have a little bit of a cushion there, so maybe your front is a little bit more rounded than others. That is totally okay. You still have these muscles that are in there, okay? So we have our pelvic floor. We have our belly or our abdominal muscles right here. Then to our sides, we have our oblique muscles, which are also abdominal muscles, right, that are on the side. But then what do we have in the back? What do we have in the back here? We have our back muscles, right? So these back muscles are in charge of keeping our pelvis in the right position and basically keeping us upright. Now, all these muscles work together. They all work together so that we can have a sturdy support system. That's what we call our core, right? It's our support system. Now, our core is really important for it to be sturdy because if our core is not stable, we're going to have a difficult time maintaining a good posture. We're going to have a hard time sitting up. We're going to have a hard time walking. Even sleeping can be painful because your body needs to be able to resist some of these movements. And that's why we like to see strong core muscles. Now, all of these muscles are your core. So your pelvic floor, your abdominals, and your back muscle, as well as your hip muscles are included in that, but not today. We don't have hip parts. I don't have those props. So let's take a look at a different model, okay? Instead of using the box, what if we were to look at a pelvis? Now, clearly this is not a real pelvis. It's just a fake plastic one, but it will give us an idea, right? So here's your pelvis. Oh, let me do it this way. Here's your pelvis. This is the front. And right up here are your abdominals, right there. And if you touch this part right here, so if you were to touch right under your belly, you would feel these bones right here, okay? And those are called your pubic bones, and you would feel those. And right above that are your abdominals. Now to the sides, or it's called your rectus abdominis, which is that beautiful six-pack muscle that we all do have. Some of us are just a little bit more padded than others, but we all have it, I promise. So you have the abdominal. And then on the other side, you have your obliques. And then, of course, in the back, you have your back muscles. But that's only part of the problem, or that's only part of the core. Because if we don't look at the pelvic floor muscles, then we have no bottom to our box. Kathy, okay, I just have to share this with everybody, Kathy. This is what Kathy says. She says she hasn't felt her bones in years. Oh, Kathy. Well, maybe you can try today. So if we're looking at the bottom of our pelvic floor, right, this is what keeps everything in. And you're like, okay, well, what does it keep in? Well, let's see. It keeps in our bladder. Yep, that's your bladder. It keeps in our intestines. That's just part of it. That's your colon there. It keeps in our uterus. This one's kind of falling apart, the uterus, but everything that's associated with that, right? Plus, it keeps all of the other stuff on top. So if the bottom, all of the other stuff in the places that it's supposed to be. So if in fact our pelvic floor is weak, that is just like having a soggy bottom of a box, of a cardboard box. And all of this stuff is pushing down on that soggy bottom. Let me go back to the box just for a second, because if we have a soggy bottom box, think about what would happen, right? So here's the front. If the box is soggy and things start to fall out the bottom, then what happens to the sides? They're going to start to cave in, right? They're going to start to cave in because they don't have the support that they need. Now, if you have a weak pelvic floor, and we're going to talk about how you know if you have a weak pelvic floor in just a minute, okay? But if you have a weak pelvic floor and your muscles start caving in, well, they don't really cave in, right? They have to stay in place. But what they start doing is they start talking to you. And they start letting you know that they do not like what they're doing. In fact, it's very difficult for them to continue to do their job because they don't have the foundation there on which to support themselves to do their job. So again, your back is responsible for so many things, for movement and stability. And if you're not able to keep those back muscles on a good foundation, then that's when they can start aching. And that's when they can start giving you lots of pain. And that's when you can do heat, you can do ice, you can do stretches, you can do exercises. Your back muscles can be super strong and you're still having pain. If that's the case, if you've been out there, you've been working out, you've been doing all this crazy stuff with your back, and yet you're still having problems, it may not actually just be your back. It could also be that your pelvic floor is not functioning properly. I hope that makes sense to you guys. Let me know in the comments how that, if you have any questions about that, or if that makes sense to you. Can you see yourself as a box like SpongeBob SquarePants? Can you see what could happen if your pelvic floor isn't where it should be, or have the right kind of tone and function that it should have? It's really difficult for your back to get better if you do not have the pelvic floor muscle. So this is what I want to do. I want to talk to you now about what you can actually do to stop this kind of pain if this is indeed what you are feeling, okay? There are definitely some things that we can do. I would like to know too, if you have been experiencing this kind of pain, what sort of things have you been doing? Have you ever had your pelvic floor checked? Let's talk about some things that you can do to get rid or to treat your back pain. So even if it's associated with pelvic pain. And again, if you have any questions, or pelvic dysfunction rather, if you have any questions, make sure that you put them in the comments, because I'm going to get to all those questions in just a minute. All right. I see nobody has a question just yet, but I'm ready for you if you have one. Okay. All right. Let's start with some things that you can do. First thing you can do stretches. Now, you can stretch your back. By the way, this goes both ways. Sometimes you can have pelvic pain because you have issues with your back. Because if your back is not strong enough to keep you in the correct position, that's putting a lot of stress on that pelvic floor. And actually, the same thing can happen if you don't have enough strength in your hips. It can overload the pelvic floor. The pelvic floor is doing much more work than it needs to be doing. And because of that, you can start to have pain in your back, or you can have pain in your pelvic floor because you have a weak back and weak hips. Sometimes pelvic floor pain really doesn't have anything to do with the actual pelvic floor. Sometimes it's the surrounding musculature that's the problem. Okay? So, what can we do to make it feel better? Well, the first thing that we can do is, like I said, we can stretch our back. Now, next week, maybe not next week, the next time I go solo, I am going to have I'm going to have some video ready for you guys, so you'll kind of have an idea so you guys will kind of have an idea what you can do, what it looks like. Today I don't have any video, but let's talk about how to stretch your back. There are 2 stretches I'm going to tell you about that are pretty easy to do, that you can do because you're lying down twice a day. I always say, in the morning before you get up and at night before you go to bed, you're already in the position, so you should do your stretches at that point. The first one is a very gentle, very easy stretch. This is good for both your pelvic floor, your hips. Actually, both of these are good for your pelvic floor, your hips, and your back. And the first one is just bringing your knee up to your chest, or as close up to your chest as you can. If it's difficult for you to put your hands around your leg to bring your leg up, then what you just need to do is take a towel, and you can use a towel and just loop it under your knee and bring it up that way. So you want to hold that stretch for 30 seconds to a minute if you can. So you do both, and do both legs. One side is probably going to be tighter than the other, but what that does when you're in that position, when you're lying down and you're bringing your knee up to your chest, is it elongates all of those muscles in the back and your glute muscles. And even on the inside, we've got some stuff happening with your hips and the pelvic floor. So it's super important to just stretch that out, breathe into the stretch, and do that on both sides. The second stretch I'm going to tell you to do is while you're lying there, you lie down on your back with your knees bent, and then your feet at least hip width distance apart. They can even be wider than that if you would like. And you're just going to let your knees drop to one side, and you'll feel a stretch in your hip and in your back and kind of all over the place. And then you'll do another stretch. Now, be careful with both of these stretches. If they cause any pain, then stop doing them right away. Don't do them anymore, okay? And just talk to somebody, reach out to somebody, whether it's me or a physical therapist who knows how to treat you. Almost all physical therapists know how to do this stretch anyway. So you're just going to go back and forth. Again, holding the stretch. This time you don't have to hold it for 30 seconds to a minute. You can hold it for 10, 15 seconds. You can hold it that long, whatever you would like to do. Just back and forth a few times. Again, you want to do it during the morning and at night. That's going to loosen things up. Guys, and if you do have any questions, I'm just going to remind you one more time. If you do have any questions, go ahead and write them in the comments. I'm going to get to those questions in just a minute. So I don't want you to miss out on the opportunity, if you have a question, that I can answer you live right now, and we can follow up and have that discussion. The second thing, and I love this activity. I love it. It is so much fun. The second thing you can do is to make sure your muscles in your back are activating. Especially you have these little teeny tiny muscles that sometimes won't activate properly, or they're not activating properly if you have back pain. They're called multifidi. And one of the ways you can actually feel it, although it's hard to feel on yourself, but you want to, where's my pelvic floor? Here we go. What you want to do is you want to palpate the spine. So you want to touch the spine. You can feel this right through your skin. This is the part where you feel whenever you're feeling your backbone. That's what you feel, right? And then you just want to slide to the side, one side or the other, it doesn't matter. But go lower down, just right down through here, especially where you're having back pain, okay? So you want to put your finger to the side, probably your thumb if you're doing it on your own. And then, this is super easy. As you're doing that, I'll come to the side here. Well, it's kind of kitty quarter here. Okay, as you're doing that, you're just going to lift your arm up. And as you lift your arm up, you'll feel that muscle pop right into your thumb or finger, whichever one you're using. That's telling you whether or not those muscles are working. If they're not working, then we need to work to get those muscles working. But even just practicing lifting one arm up at a time will help to activate those muscles so that they're performing properly, and they can help to take some of the load off from your back and your pelvic floor. The last part of this, so we talked about stretching your back. We talked a little bit about strengthening your back or making sure that it's activating properly. The last part of this is really important, and that is just to work on your pelvic floor. So what does that mean? Well, it depends. Let me tell you this. If you have urinary incontinence or bowel incontinence, then it's very likely that you have weak pelvic floor muscles. So if you leak a little bit when you cough, laugh, or sneeze, or you can't get to the bathroom quick enough before you have a little bit of an accident, there is a very high likelihood that you have weak pelvic floor muscles. Now, you can have weak pelvic floor muscles without having pain, and vice versa. You can have pain without having weak pelvic floor muscles. So this is not pain is not the indicator here in the pelvic floor. It's whether or not you're able to hold in urine. That's one of the ways that we can determine whether or not you have a good, strong, healthy pelvic floor. It's not the only way, but it's a way that you can determine at home. So what you can do is, first of all, think, oh, do I have any accidents? If you do have accidents, well, then that's probably an indication that you have a weak pelvic floor. If you also have back pain, now you know, hopefully, now you know that those things can go together. And so your back pain may very well not get any better until you fix that pelvic floor. When I was working in orthopedics, this was definitely something that I talked to almost all of the women who I worked with back pain. I always asked them if they also had incontinence. And if they did, we would have to work on that, because there just was a low likelihood that their back pain was going to get better for a long period of time if their pelvic floor wasn't working properly. So that's if you're having those issues, you need to seek someone out. If you need help with finding someone, you can message me just in Messenger, or you can write it in the comments, and I'll be more than happy to provide you with some resources that you can use so that you can find the appropriate person for you. Probably not your GP, your general doctor. That is not the person you're going to need to go to. You probably need to go to either a gynecologist or a urogynecologist, but honestly, to start with, it might be easier just to go to a PT, because then you at least have an idea as to what your muscles look like before you go, and then they start putting you on all this medication that you may or may not need. Probably don't need, actually. Okay, so we've had a good discussion today, right? We've talked about, I'm going to get to your guys' questions in just a second, but we've talked about how your body is like a box, and how without the pelvic floor being strong, how everything else can kind of just collapse around it. But we can avoid that by making sure that our muscles and structures around us are working properly. So right now, I want to get to some of the questions, and then we'll finish off here. So here's a question from Heather. What areas of the back hurt in relation to pelvic floor weakness, or is it just lower back? Okay, so Heather, this is a great question. And in the beginning, At the broadcast, I actually talked a little bit about it. I used the analogy. I had my prop of my string. I'm a prop comic today, guys. I have my string here. Um, your back can hurt everywhere if you have pelvic floor pain for lots of reasons. Because if we think about it, our position of comfort, no matter what your pain is, whether it's in your arm, in your leg, in your stomach, our position of comfort is one that is hunched over, right? So if you're hunched over, that's definitely going to compromise all of the muscles in your back, not just your lower back. But your lower back is definitely something that's going to be affected whenever you can have that pelvic floor weakness. But you can hurt anywhere, Heather. Um, and actually, you can have neck pain. I ask people about neck pain and headaches too, when it's associated with when they have pelvic floor pain, because especially if their pelvis is out of alignment a little bit, that can really throw off the spinal cord or the spinal column, which can make the muscles have to work extra hard, just like the box, things start collapsing in and not working properly. So Heather, I hope that answers your question. It's not limited to your low back. That is the area that most people will complain about, is the low back, but it's not limited to that. So thank you for that question. That's a great question. I hope that that answered. If not, then go ahead and let me know in the comments, and I'll be more than happy to expand on that a bit. Okay, Kathy has a question for me. How can you stretch a tight belly, a rectus abdominis? Okay, it's very it's so the rectus abdominis. Oh, sorry. Thanks, Heather. I'm glad that makes sense to you. The rectus abdominis is that six pack muscle that I was talking about before, and it's really designed to contract. Well, all of our muscles are designed to contract and relax. And if you watched our live video last week with Dr. Scrivani, you'll remember that. But these muscles in particular are designed not to be overstretched. So there's typically not a reason, unless there's some scar tissue associated on the rectus abdominis, there's typically not a reason that you need to stretch that particular muscle. So I'm wondering, Kathy, if maybe you're feeling some tightness in some other areas, like maybe even your obliques or perhaps your hip flexors, which are right underneath your abdominal muscles there. I wonder if those are the muscles that you're feeling that are so tight. Because if you have tight hip flexors, then they can certainly feel like your abdominals. In fact, sometimes they can radiate up to that, especially that lower abdominal part. So to stretch it, the best way to stretch it would actually, and I do not recommend this, so do not do this at home unless you are super flexible or under the age of 3 maybe. The best way to actually stretch the muscle is to do like back bends, and anything that requires you to go backwards would be a way to stretch that muscle. And there are ways to do it safely, but I would really have you go to a professional to kind of assess you and determine whether or not that is something that needs to happen, because it's rarely the case that it's the rectus abdominis muscles themselves that are tight. There could be some scar tissue around that, and that might be the area that's tight. Okay. Thank you so much, Kathy. I appreciate that. Okay, now we've got one from another Kathy here. How can I get out of bed in the mornings without leaking before I make it to the bathroom? Fine, as long as I lay still, but it's embarrassing. Yes. Believe me, Kathy, when I tell you that you are not the only person that has this issue. There are so many women that have this issue, and they just don't. It's something that we don't talk about very often. And because we don't talk about it, people don't know that lots of people have it. But as someone who treats this, I'm here to tell you many, 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 many women and men have this issue. Okay, so let's talk about this. If it's only in the morning that you have difficulty getting out of bed and making it to the bathroom, part of the reason is probably, I'm going to assume some things here. I'm going to assume that your urge is probably very, very strong in the morning. So probably your nervous system is kicked into high gear. So and you may be even afraid that you're not going to make it to the bathroom and that you're going to have an accident. If that's the case, then what that does is that kicks your nervous system into a even higher gear. So when your nervous system is super charged up like that, guess what it wants to do? It wants to tell those muscles to contract. So you are going to have a harder time making it to the bathroom. If you're able to hold your urine throughout the day and you don't have any trouble with leakage any other time, and it's really just in the morning, then the first thing I would tell you to do is to slow down, which is probably the opposite of what you want to hear, because in your mind, you're thinking, I got to get to the bathroom. If I don't get to the bathroom, I'm going to have an accident. But what I would encourage you to do is to wake up, take a few breaths, deep breaths, so that you can calm the nervous system. Then stand up and walk at a normal pace to the bathroom. And I'm going to tell you, I'm going to be honest with you here. The first couple times you do that is going to be so hard. And your body is going to want to rebel, and you may even have a little bit of leakage. But if you continue to do it on a daily basis, day in and day out, and you're able to calm that nervous system, your bladder is definitely capable of holding the amount of urine that's produced in your body throughout the night. It just is. But during that time, it also probably has the most amount of urine in it when you first wake up in the morning. If you think about it, it's probably the longest pee that you have throughout the whole day is when you go to the bathroom in the morning. So calming that nervous system, and reassuring yourself that your bladder is not going to explode, that it can handle the load, that your muscles can keep control of it, but being able to just keep control of that nervousness is going to be the first step to being able to go to the bathroom without having issues. So I hope that helps, Kathy. If it doesn't, then let me know. Of course, you know where I am. So feel free to reach out to me if you do have any more questions. Guys, we are at the end, and I was so afraid I wasn't even going to get like 15 minutes in, and we're at 34 minutes, which is a long time. Thank you guys so much. Let me know, did you like the props, or was it distracting? Because I'm a big person. I like analogies. Good, Kathy. Good. I definitely want you to try. I would love your thoughts. Do I need more interesting props? What is it that you got out of this? You don't have to answer right now. You can always come back. But thanks so much for joining me. Next week, I'm actually going to be joined by a massage therapist. She's amazing. We did a live a few months ago, and I love her. And she's just a lot of fun. We are going to be talking about how to give yourself self massages, okay, in specific muscles that can be super painful, or muscles that can be really affected by pelvic floor pain. So definitely join me next week with Jan, and Jana last week, and now we have Jan this week. Join me next week so that you can answer any kind of questions you have. We're going to show you things that you can do at home, because it's so important for me that you guys have a takeaway. If you do have any questions, then obviously you can always message me. This is my name. Of course, you're on my page right now. And I will bring props, maybe at least when I'm solo. At least when I'm solo. All right, guys, thank you so much for joining me. I will talk to you next week. And remember to take care of yourself. Take time to take care of yourself, because you know what? You deserve it.